Morning, everyone. Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, anti-aging, longevity, and much, much more. So hopefully everybody's having a great morning. I get up early today and I'm going to shoot my video, get the day rolling. So hopefully you are doing the same. So remember, hopefully everyone can enjoy these videos. And like I said, please comment below. Let me know what else you want me to talk about. I'm helping everyone across the country with to my telemedicine, my online coaching programs, and my online programs. So I help especially those over 40 optimize their health, hormones, and metabolism so they can live a life full of strength, energy, and vitality. That's what I've done for many, many patients, hoping to do them for you as well. So I've been doing a little series on testosterone, specifically the onset of effects. I'm reviewing a paper, a scientific paper that I read, and reviewing and explaining, because this comes up a lot. People always ask, well, when can I expect to see results, right? So check out the first one if you missed that one. So it's an intro, and it's very important actually, because it explains the rationale for a lot of things I'm going to talk about next. So today's a quick one, because one of the more common ones, I guess, especially from the guys, but women ask me this too. So, and then we do several more of the next week. So pay attention and enjoy. So again, onset of effects, when can you expect? Again, as I mentioned, the first one, it depends, right? The pharmacogenomics, the pharmacodynamics. Again, tune into the first one, very important. But today I'm talking about strength and muscle mass and bone, because they work together, of course. They're extremely important, as I've talked about before. That's why I practice muscle medicine. Muscle and bone are the two most powerful and important endocrine organs in the body, not just for structure and form of the body and movement, but also for generating all kinds of other benefits to the body. They secrete myokines and other cytokines that are beneficial for optimal metabolic health. So in general, again, there's more to this article, but you know me, I like to keep it super simple, especially for you guys. So in general, onset of effects, especially for strength and muscle mass, or again, a lot of variability, but roughly right around 12 to 20 weeks. So usually within the first 3 to 6 months, you'll start seeing some changes, and within 20 weeks or so. Maximum, usually about 6 to 12 months. So again, a variable, but I typically tell guys most of the time by 6 to 12 months when you're going to see that. Now, this is especially for strength and for muscle, but of course, this is the one exception to the general rule that it's dose dependent, right? Of course, you can get stronger, put on more muscle with more testosterone. Of course, bodybuilders have been doing this forever, but this is where you have to be very careful. This is where I do not always encourage patients to do this, because this is not something you should be doing, right? If you're not going to be a professional bodybuilder, you don't want to be taking 6, 8,000, 100,000 milligrams of testosterone a week to put on as much muscle as possible. These are guys, this is their career, this is a profession. Is it safe? Don't know. You know, there's a lot of things that have happened to guys who do, not just from testosterone. Of course, I know a lot of people have done other anabolics and many other things too. But in general, it's not always the best for your health, right? More is not always better. And I know some people argue that, say, sure, you can totally do that. But with caution, again, most guys don't need that. Most women don't need that. If you do moderate doses, even low doses, sometimes lower is better. I've had a lot of guys who are on really high doses and have had some side effects and not done as well, and I've lowered them back down and tweaked the regimen. They felt much better. This happens a lot, so more is not always better. But the reason I'm bringing this up is because some guys will say, oh yeah, but your strength will you can keep putting on muscle if you keep upping the dose. Well, sure, of course, but again, there's a tipping point, right? Again, more is not always better. Again, it's all about balance and optimizing your health. You want enough, not too much, not too little. You want to be in that sweet spot, right? So again, these are the exceptions. These are not the things you want to be doing for your average person, for most people, really for anybody. But that's the caveat. But in general, 12 to 20 weeks, in ballpark 6 to 12 months, so by 12 months or so, usually about a year, that's where you're going to be. You know, can you put on more muscle and get stronger, keeping the same dose by tweaking your regimen? Doing other training protocols, mixing it up. Of course you can. That's, people have done that for hundreds of years, right? This is the way it used to be done, even before. Like, look at Vince Gironda and all the other classics that they great, but even before, steroids and testosterone was available. Of course you can put on more muscle. That's the whole point, right? That's we can do things as naturally as possible. But again, I'm just trying to throw this out there that this is one of the things that can help. Bone, again, bone benefits, of course, keeping that bone health strong, preventing osteoporosis, especially in the bones in the spine and the hips, the extremities, etc. Again, usually around 6 to 8 months, but some studies have shown up to 36 months. Of course, it takes a bit longer to lay down bone and build new bone, right? Sometimes it can take a year or two. But again, that's why some of these studies, it could take up to 2 or 3 years to see maximal benefits. So if you're looking doing like a DEXA scan or another scan looking at your bone structure, it may take a bit longer. But the bone resorption markers tend to go down pretty quickly. Those are things that you measure in the urine to see if your bone is being broken down. That picks up a little bit quicker. So it takes a little bit longer. But again, most people are going to be on this for their lifetime or at least a number of years. So you're going to see those maximal benefits, and those are going to be very, very important. The other important thing is that it's not just about the testosterone. A lot of the benefits for the bone and for the muscle come from estrogen, conversion into estradiol. So that's very, very important, which is why, again, I encourage my men not to worry about their estradiol numbers. You don't want to block it and lower with aromatase inhibitors and anastrozole, things like this. I've talked about this ad nauseum. You don't want to block. Actually, a higher number is better. Again, to a point, but for the most part, you want a good level because you're going to get a lot of these benefits with strength, libido, fat burning, fat loss with estrogen. Actually comes from estradiol, not from the testosterone, or from the other metabolite that I've talked about before, which is DHT, which is why you don't want to block that. So talked about that before. I'm not going to dig in too much of that right now. So very important. So little caveats there, little tweaks and pearls. So hope you enjoyed this one. Tag this, share this post. Let me know what else you want to talk about. Check me out at drericprimax.com. I'm going to be launching my cellular nutrition and fitness course this week or this month. And then other courses, and I have a lot of other stuff available for free and a few things that are cheap and paid for. You can pay for. You can buy programs, courses, little PDFs on my website as well. I'm all over social media. Check me out and please share. I love to spread my message. You know, my other message I love to spread: live to give, baby. I want everybody to feel good about themselves so they can make other people feel better and pass it forward to other people, help other people live their best life. So everyone have an awesome day, and we'll talk to you soon. Bye.